Hello everyone. Welcome to my channel. Here we will be learning clinical medicine concept in simplified manner. Let's begin. Today's topic is breath sounds and their types. Breath sounds have intensity and quality. The intensity or loudness of the sounds may be normal, reduced or increased. Breath sounds will be normal in intensity when the lung is inflating normal, but may be reduced in localized airway narrowing, emphysema, pleural thickening or pleural fluid. Breath sounds may be of increased intensity in very thin subjects. Types of breath sounds. Normal breath sound is called vesicular breath sound. Abnormal breath sounds are of two types: diminished breath sounds and bronchial breathing. Third category is added sounds. They are of four types: wheeze, crackles or crepitations, pleural rub, and stridor. Vesicular breath sounds. These are the normal breath sounds of lungs. Sound is soft and low pitch. Inspiration phase is longer than expiration phase. No gap is seen between both phases. Bronchial breath sounds. In consolidation, sounds generated in the large airways are transmitted more efficiently, so they are louder and there is less filtering of high frequencies. Classically heard over an area of consolidated lungs in case of pneumonia. Sound is loud, high-pitched and tubular quality. In expiratory phase, hissing character is more compared to inspiratory phase. Inspiratory and expiratory phases are equal. Definite gap between both phases is seen. Bronchial breath sounds are heard in consolidation, lobar collapse with patent bronchus, lung cavity. Wheeze. They are musical sounds associated with airway narrowing. Usually heard in expiratory phase. It indicates narrowing of airways either due to bronchospasm or secretion in small airways. Low pitch or high pitch. High pitch or sibilant wheeze are the usual whistling quality wheeze heard due to smaller airway narrowing in bronchospasm, like in asthma. Whereas low pitch or sonorous wheeze are also called as rhonchi, heard when smaller airways narrow due to secretion. Example, chronic bronchitis. High pitch wheeze are usually of two types: polyphonic wheeze and monophonic wheeze. Polyphonic wheeze is usually high pitch wheeze due to variable degree of bronchospasm, like in asthma or chronic obstructive pulmonary disease. And it is more commonly seen in practice. It is particularly heard in expiration. Monophasic wheeze is heard if there is obstructing pathology in localized area. It can occur in localized narrowing of single bronchus. It may be inspiratory, expiratory or both. And it changes intensity with position. Crackles. They are short explosive sounds often described as bubbling or clicking. Sounds are interrupted and non-musical quality. They are usually inspiratory sound. Peripheral airway collapse on expiration either due to interstitial fibrosis or secreting fluid. During inspiration, rapid air entry abruptly open these collapsed smaller airways and alveoli producing crackling noise. Crackles can be early inspiratory, in small airway disease like bronchiolitis. Mid-inspiratory, in pulmonary edema. Late inspiratory, in pulmonary fibrosis, pulmonary edema. Chronic obstructive pulmonary disease. Resolving pneumonia. Tuberculosis and lung abscess. Later inspiratory sound are said to sound like rolling your fingers through your hair near your ear. Phasic, in bronchiectasis. Crackles are of two types: Fine quality and coarse quality. Fine quality are heard in bronchiolitis, pulmonary edema, and in pulmonary fibrosis. Coarse quality are heard in tuberculosis, lung cavities, lung abscess, chronic obstructive pulmonary disease, resolving pneumonia, bronchiectasis. Pleural rub. It is characteristic of pleural inflammation, and usually occurs in association with pleuritic pain. It has cracking or rubbing character. Said to sound like a foot crunching through fresh fallen snow. Sounds resembling pleural rub may be produced by movement of stethoscope on the patient's skin or on patient's clothes. Pleural rub are heard in consolidation, pulmonary infarction, and uremia. They are heard during inspiration when visceral and parietal pleura slides over each other. Stridor. It is associated with laryngeal disease or localized narrowing of the trachea or larger airways. It almost indicates a serious condition requiring urgent investigation and management. The noise is often inspiratory and expiratory. It may be heard at the open mouth without the aid of stethoscope. On auscultation of the chest, stridor is usually loudest over the trachea. To hear the lung sounds, I have mentioned the links of the videos in my description. To hear them after watching this video, for better understanding. Thank you everyone. It was my first video. Do encourage and motivate me to make more videos by like, comment, and subscribe to my channel. Stay tuned and keep learning.